So the MLS was something we brought into the practice that was non-invasive, non-toxic, risk-free, pain-free as I teach my patients. And it has been an absolute game changer. I'm always looking for kind of that next thing that makes the patient's lives easier, makes our treatments more efficient. I do like moving forward type of stuff. I mean, why do the same thing that they were doing in the 70s? But of course, I only do it if it's tried and true and tested. I'm not going to do the latest and greatest and jump on it. I do my homework. I definitely do my homework before I start anything.
You just gave a presentation yesterday, correct? With
I did.
That was about the MLS laser
Mm-hmm.
and the impact that it has had on your practice. Do you mind sharing, a little bit about that? What was shared yesterday before we kind of get into the whole GSN experience?
Yeah, of course. Well, the MLS was something we brought into the practice, I'm going to guess 5, maybe 6 years ago, as a nice, another tool for the toolbox, a nice treatment modality that was non-invasive, non-toxic, risk-free, pain-free as I teach my patients. And it has been an absolute game changer because it's become kind of the top of the crop with our treatment protocols on what we're doing to manage the many pathologies we see, our post-op patients, our injuries, our neuropathies. And I can't thank that company enough. The rep, Joe, who was on the call last night, he got me involved with it. And we are the premier provider in our area for that device. So it's been great.
Nice. I've noticed that it was stated that, this is something that can increase your profitability. And, I was wondering how.
Well, it's a cash pay modality. So therefore, we don't have to deal with insurance. Okay. And for the patients, what's going on in their mind is, what can you do to get me better as fast as you can, as safely as you can, preferably without surgery, all those things that I know I, as a patient, would want, of course. So people are willing to put out what they need to put out to get themselves better, because they know insurances these days, they're fairly useless, if you know what I mean. Yeah. They don't cover well. Their deductibles are stupidly high. Mm-hmm. So it's just such a benefit to the patients that they can have that modality to get healthier quicker.
Yeah, it kind of reminds me of PRP injections. Some years ago, I feel like PRP injections were very popular treatment plan for chronic plantar fasciitis, but it wasn't covered by insurance. I'm not sure if that's still, is it covered by insurance now? Or
no, it's still not covered. And it's sort of faded. I mean, it's out there. I used to do them fairly regularly, but I'm moving more now towards regenerative medicine with the chorionic allograft type of thing. We're introducing that into our practice now as well.
Nice.
As an updated version of that kind of stuff.
Nice. One last thing before we jump into these questions. I'm very impressed by how open-minded you are with new treatment options that come across your table. And I think that's why you are able to operate at such a high level, because you're open to these things. Now, obviously as physicians, as providers, we want to, reduce risk at all costs, and I feel like that might be the main reason why a lot of providers are hesitant to try new things. Like even with using us, we're a new company and you tried us. What did it take for you to tap into that mindset? Have you always had that mindset of being open-minded and trying new things, or was there a certain something that happened in the past that made you say, hey, I need to do this more often?
Yeah, I think it's, I tend to be progressive with my thinking. I like to think in the sense that I'm always looking for kind of that next thing that makes the patient's lives easier, makes our treatments more efficient, more collectively comprehensive for the patients. I do like tech. I do like moving forward type of stuff. I mean, why do the same thing that they were doing in the 70s with steroid shots and, old-fashioned surgery, if you know what I mean? If we can update, come on, we're in a new millennium. So you should move along with that as a practitioner. But of course, I only do it if it's tried and true and tested. I'm not going to do the latest and greatest and jump on it. I do my homework. I definitely do my homework before I start anything.
Awesome. Yeah, you definitely do. And we'll get into the questions a little bit, and I'm sure you will share how you did your homework with, going through those modules on the recruiting process.
Big time.